Hello, I'm Dr Louise Newson. I'm a GP and menopause specialist, and I'm also the founder of the Newson Health Menopause and Wellbeing Centre here in Stratford-upon-Avon. I'm also the founder of the free Balance app. Each week on my podcast, join me and my special guests where we discuss all things perimenopause and menopause. We talk about the latest research, bust myths on menopause symptoms and treatments, and often share moving and always inspirational personal stories. This podcast is brought to you by the Newson Health Group, which has clinics across the UK dedicated to providing individualised perimenopause and menopause care for all women. So today on the podcast, I've got someone called Melanie Verwoerd, who actually is from South Africa. And I don't think I've interviewed someone who's been in South Africa before. So this is a first, Melanie.
Oh, lovely. And hello from Cape Town.
Yeah. So you reached out to me and you've written a book, which we'll talk about, but it's about knowledge sharing. A lot of the work that I do, many people realise, is about sharing information, sharing knowledge. So as individuals, we can decide what's right for us. So tell us a bit about you, and we'll talk a bit more in a lot of detail about hysterectomy, the operation to remove a woman's womb. So if you don't mind just saying a bit more about you, if that's okay.
Yeah, thank you so much for having me. It's lovely to speak to you and to all your listeners. And thank you for what you do for all us women all around the world. So I don't come from a medical background. I have a political background. I was a member of parliament in South Africa with Nelson Mandela. And between our transition, 1994 to 2001, I then became South Africa's ambassador to Ireland. Did that for 4.5 years, then became executive director of UNICEF in Ireland, and then came back. So my day job, I'm a political analyst, and I also write for newspapers. But in the middle of 2021, so during the COVID time still, I went for a regular gynecological checkup. And I was lying there on my back, and the gynecologist was having doing an ultrasound, and we were chatting away with our mothers. You know how it is. You always talk as much as you can when you're having a gynecological examination, just to not concentrate on what's happening down there. And she suddenly went very quiet and just said, "Ooh, what's going on here?" And then the whole atmosphere in the room changed. It's like, I think anybody who's ever had bad news from a medical doctor knows what I'm talking about, and said, "Look, can you quickly run up and go and have some blood tests done?" And I said, "Sure, but what are you looking for?" And she said, "Well, cancer. I can see a huge ovarian growth." And it really shocked me, because I had zero symptoms, and also I'd been perfectly well. And I have gone for gynecological checkups every year, and there was nothing the previous year. And then I got on this very fast-moving train of medical tests and CT scans and seeing more specialists. And a week later, a radical hysterectomy, we can talk about the terminology, of course, was performed. And that then put me on this whole journey, which resulted in the book and eventually also in a podcast, because I realized just how many women go through this procedure, and yet there's such a lack of information.
And how old were you when you had the operation, if you don't mind me asking?
Not at all. I was 54, so I was lucky in the sense that I had largely gone through menopause. In fact, the day that I went to the gynecologist was a year after my last period, so I was officially in menopause. So in that sense, for me, having the ovaries removed, of course, there's always still some latent hormones present, and I did have, again, menopausal symptoms. Again, flushed a bit and felt very down, which could have also just been the operation. But so I was lucky in the sense that I wasn't put into surgical menopause. I think that is an additional nightmare on top of everything else when you get such a big operation.
Yes. So I mean, a hysterectomy is just removal of the womb.
Yes.
Which is what it is. But like you say, there are different types of hysterectomy, actually. So a simple hysterectomy is literally just removing the womb, but it can be done. There's also a subtotal hysterectomy, which means that the womb is removed, but the cervix still remains. And 20 or so years ago, it used to be a very common operation because they thought that there was more stimulation, and certainly for penetrative sex, it was more pleasurable for the woman to keep the cervix. But actually, there's not really been good studies about that. Some people think that they're more likely to have a prolapse if they don't or do remove the cervix, but again, it's not really so. So a few people, for various reasons, might still have their cervix remaining and have a subtotal hysterectomy, and that's important to know, obviously, because you want to know, have you still got your cervix if you need to have cervical screening or whatever. So, but essentially, a simple hysterectomy is just removing the womb. And then we also often talk about TAH and BSO, because in medicine we love having abbreviations, lots of letters in people's notes. But that means total abdominal hysterectomy, which means that the operation's through the tummy, there's a cut in the tummy, and removal of both ovaries. But that can also be done in a vaginal way as well. So quite a few people only have their womb removed. Some people have the womb and their ovaries removed. And then you had more removed, didn't you?
Yeah, I had everything removed. So as I understand it, and it might differ from country to country, but from what I understand is that if they sit with a big ovarian growth, and mine ended up being the long end of a credit card, so the circumference, it was like that. They are worried, first of all, of doing it vaginally because they do not, or laparoscopically, because they do not want any part of the tumor to chip off on, if there is a possibility of cancer. So they usually then do an abdominal hysterectomy. And because they are, in my case, wasn't 100% sure that they could do the test, the lab test in the theater. They then did a preemptive radical hysterectomy. So they removed, as you said, the womb, of course, the ovaries, the cervix, some of the ligaments, and then also what's called the sort of fatty tissue, the omentum, they call it, the fatty tissue or curtain that hangs over your organs, because I was told, and you can correct me, but that's often where especially ovarian cancer tumors like to go and hide. So it was a fairly radical operation. And thankfully not all women go through such a radical hysterectomy. So, and of course, particularly because it has an abdominal wound that took very, very long to recover from. And I think that was partly why it was so important for me to do the knowledge sharing, was because just before the operation, I tried to get books, to read. I'm a brainy person. I like reading stuff to be prepared and be in control, and I couldn't really find anything around hysterectomies. I could find medical journals, but that wasn't helping me at all to prepare. And then post the operation, I started looking also for, information online and so on. And then I discovered all these huge Facebook groups of women who had gone through hysterectomies. Often it's linked very closely, of course, to menopause, because it's often women who are sort of in that period of their lives and who were so frustrated, so anxious, many of them also in the NHS, because they felt that they got no support and no information. And they were asking each other, which is nice, but of course not the most reliable when you want to get medical information. So, there was one example I remember where somebody said, went onto the group and said, I am 8 days post hysterectomy. I just had a big bleed, big blood clots all over my kitchen floor. What do you guys think? Should I go to a hospital? Is this normal or not? And of course you want to shout, don't come onto a group, please just get yourself to emergency. But that sort of was an illustration for me. And these groups are everywhere in the world. They are not they're not just South Africa. In fact, South Africa is a very small group, but Australia, the UK, America, in Europe, everywhere. Because, you said it was a fairly common procedure, but it still remains a very common procedure.
Yes.
In America alone, 600,000 hysterectomies every year. And I think still many doctors very unwisely, I want to almost venture and say particularly male doctors, when women go into menopause and they experience sometimes menopausal symptoms, or any other legitimate gynecological, this becomes the operation that they turn to. And yes, in some cases it is needed, and it's life improving, and it is life saving in many cases. But I don't think it's an operation that should be done easily and as the sort of easy option to deal with menopausal symptoms. And that's been sort of part of my little activism now, is to say, just make it a last resort, not the first resort, if women start struggling in middle age.
It's really interesting. So I did, when I trained to be a GP, I'd done a lot of hospital medicine. So I didn't have to do lots of jobs to become a GP. The only job I had to do was an obs and gynae job. And that was a long time ago. That was in 1999. And there were lots of women who, in retrospect, were middle-aged women, menopausal or perimenopausal, who were having heavy, heavy periods. Marina coil it was only just sort of coming out then. And so a lot of people had a hysterectomy for that. And I just thought, gosh, you're having an operation, but in a couple of years' time, your periods will be stopped. So anyway, but also as a doctor, we see people when they're operated on, in the hospital, and when we do a 6-week check quite often.
Right.
And I've done this a lot as a GP. You see babies 6 weeks old, the mothers, for a 6-week check. So you don't realize the enormity of what's happened in that 6 weeks. And then my mother had she's had both hip replacements now, and I looked after her. And I've seen women 3 to 6 months after a hip replacement. They've been okay. They've been a pain, but they come into the surgery. We review everything. But day one after a hip replacement, oh my goodness. And then seeing the bruising down my mother's leg and the pain she was in. And I was thinking, gosh, I had no idea how awful it was, because the body heals quite well. And then I had a hysterectomy a few years ago, and it was a simple hysterectomy, and it was done vaginally. But oh my goodness, those first few weeks, I wasn't expecting. Because I think as doctors, we're not trained, because we don't see day by day, and people get discharged day 2 now often after an operation, don't they? So we're not seeing and learning. But I learn all the time from 2 things: my experiences, if I have them, but also from what patients tell me. So what you've done is allowed people to discuss, because we are different, aren't we? But it is still a big operation.
I know that some women, especially when they've had vaginal or laparoscopic, and it's a simple hysterectomy, they seem to bounce back. Many women do quite quickly. But the vast majority of women that I have spoken to and met, and I speak in many places now on these issues and women and medicine and so on, and the vast majority of them sit there in tears, and write to me, just for once that somebody gave validation to their experiences. And, I understand that doctors are busy, and especially surgeons and specialists, or I don't know if you call them consultants in Britain, they are very busy. So they sort of, once they've saved your life or stitched you back up, that's it, they're done, that's job done. But of course, for you, the process only starts then, right? And I'll never forget, my surgeon said to me beforehand, week 1, you'll be in bed, week 2, you'll be on the couch, and week 3, you might be in the kitchen again. Now, I objected as a feminist to the last observation, but the point was, in his mind, I should have been back doing what I do by week 3. There was nothing like that. And I'm tough, and I've gone through lots of medical things, so this was nothing like anything I've previously experienced. And it took, I would say, about 3 months before I felt closer to myself. And the point was, I wasn't healed completely. There was still pain and discomfort and energy issues for at least 6 months, and maybe even a few months after that. And I think even if we just get permission to know that it's really hard. And then, of course, you don't even talk about the psychological stuff, because I think there's a lot of psychological stuff that goes with it. I was not prepared for how long it was going to take. I was also not prepared that it was quite important to speak to pelvic floor experts, that it might impact on your sexual, your sexual activity. None of that I was prepared for. And I think then it comes as a big shock, and it's on top of it. And of course, then women who go through surgical menopause and are not prepared for that and not helped with medication or, therapies through that. I think that's just cruel. I think that's, in a way, I want to almost describe it as evil, because what they go through is hell.
Yeah, I spoke to one of my patients today who's had breast cancer many years ago. She's young, though. She's still in her mid-40s, but she had breast cancer when she was in her 20s. Estrogen receptor negative. She's had bilateral mastectomy, but she's found to have the BRCA gene. So she's having her ovaries removed to, obviously negate her risk of ovarian cancer, but she's still having periods, and she really wants to have hormones to replace the ones that she's missing, because she gets PMS already and she knows she's going to feel worse without her. And I spoke to her today because she's now got a date for her operation, and the consultant has said, let's just see how you get on without your ovaries. And I said, and they're sort of worried because she's had this history of breast cancer. Well, she's had her own periods for 20 years.
Right.
So actually that makes it a lot easier to think about hormone replacement therapy. And she wants it as well. She knows that her mental health before her periods is terrible. So she's quite rightly worrying about that after the surgery, and the health risks of not having hormones for her bones, heart and brain and so forth. But to say, see how you get on, I think is it just makes me a bit upset.
I can't tell you how many stories like that I've heard. And I was recently contacted by the mother of somebody in her late 30s who had a radical hysterectomy. And she said to me that she was deeply worried. I didn't know her. She just reached out to me via my website and said that she was deeply worried about her daughter's state of health, but also mental health. And he asked if I would talk to her. And of course I said I would, but we need to refer her to a medical expert. And then when I spoke to her, she said exactly the same thing. The doctor said, when she was released from hospital, you might start feeling a little bit off in the next day or two because, you've gone into surgical menopause, but come see me in 6 weeks' time and we'll see how you get on, And she said during those 6 weeks, because she didn't know what was happening to her, she thought it was, she didn't understand why she was feeling so awful. And then she said to me, before the operation, because hers was done because of cervical cancer, she was scared that she was going to die. Then after the operation, she got scared that she wasn't going to die because of the impact of and I think for me the thing is your patient seems to have done the right thing, and that's coming to you, but it is also sort of as women to start taking control of our health, to also insist and not take the word of one doctor. But I think it's really important then to reach out, go find the help if you have time to do it before the operation already. And then after the operation, if you're not doing well, to reach out for help. And it's not because you're weak. I think we often think we're weak. It's because you legitimately need help.
My consultant was brilliant because he said to me, each day you do a minute and then you double it. So you do 1 minute walking, then 2 minutes, then 4 minutes and 8 minutes. And I thought, look, do you know what? I'm really fit. That's ridiculous. But I took it literally because I really wanted to feel better. But actually, some days I found it really easy, and some days I found it really, really, really difficult. And I think there's two things really for me that I was not expecting so much, because I didn't have surgery. I didn't have a scar because it was done vaginally. So you look down and you think, have I really had an operation? And so I think women forget that internally you have had an operation. But the two things really was my pelvic floor. I do a lot of yoga. I do a lot of pelvic floor exercises. I couldn't even feel the muscles. Like I tried to tighten them, as you do, to do pelvic. I was like, I don't even know where they are. Have I got them?
Right.
And I knew I do, of course. So looking at that, but also like not being worried that you can't do it straight away. A lot of women, even if they're on HRT before the operation or they're having their own hormones, often need vaginal hormones when things have settled down, which is very different to HRT. And that's really important because if you're, we talk a lot about sarcopenia, this loss of muscle mass that occurs in the menopause. Well, you have sarcopenia of your pelvic floor muscles as well. So we can all do our pelvic floor muscles as many times as we can, but there's no point doing them if you haven't got the muscles there and the muscle strength. So that's something that's really important, but it can take a long time. It really can take 3-6 months for your pelvic floor muscles to come back. And I wasn't prepared for that. I don't know whether that's the same for you or people you've spoken
Definitely.
to.
And, there's all kinds of problems. I mean, as you will know, I mean, the dreaded, which is most probably, apart from sex, the thing most spoken on the groups, the dreaded constipation, after the operation, especially when it's a abdominal cut and so on. So there's a lot of pain, but also, of course, general anesthetic and slow down everything. And then women are scared and all these things. I have on the podcast series that I then did on this, there's a physiotherapist who's a pelvic floor expert that we speak to. And she talks about if women just come to her beforehand, she can teach them how to actually go to the bathroom after the operation, which can be a major point of anxiety and fear and things. So it's even little things. Well, little, it's not little when you're in it.
No, but it seems little like that. When you've got normal bodily functions. And the other thing that happened to me, which is not uncommon, is that my bladder didn't work properly. So I was catheterized, I was taken out. I couldn't empty my bladder. And the first nurse that put my catheter in inflated the balloon on my urethra. It was really painful. She didn't believe me. And I said, just give me a syringe. I'm going to take the water out and take it out myself. It was awfully painful. I knew it. And so then the consultant came in and catheterized me. That was fine. I had a catheter in for a few days at hospital. Then I had it taken out just before I went home. And then at 3 a.m, I was in so much pain and discomfort. I'm very fortunate that my husband's a urologist. So he went to the local hospital and got a catheter and everything else, and very unromantically catheterized me because I didn't want to go back to the hospital. I hate hospitals. I really didn't want to. I knew they would admit me and I didn't want to. So I had a catheter, but then I had an indwelling catheter for 6 weeks. So I had a leg bag. I was, wearing my husband's pajamas, putting me in, having a bag next to the bed. In the daytime, I'd have a leg bag initially, and then I would just have a clamp. And it was really interesting because my husband's a reconstructive surgeon, does a lot of work for people who have permanent catheters to enable them to urinate properly through their urethra. But I hadn't realized how awful it feels having a catheter in. You feel like people know that you've got it in, and of course they don't. There's something really horrible about losing control of a normal bodily function. And I then took my catheter out too early, so he had to recatheterize me. And then I had awful urinary tract infections, and many people listening, I'm sure, will have had urinary tract infections. And
very painful.
It was awful. Like, I can't even begin. There was one I had a few, and I had one that hadn't responded to 2 antibiotics. And it was just excruciating. I can see why people even become suicidal with the pain of having a urinary tract infection, because my bladder was all inflamed. It had this catheter in it. And then I had this infection, and I can't tell you, it was awful. And I'm married to a urologist. I'm a doctor. I was really scared. And I didn't know who to ask for help. I knew I couldn't get an appointment with my GP. It's accessing help and care. And, when you're in a lot of pain, it's really scary.
It really is. And the thing is, post-operative, you're also vulnerable. And
Totally.
then I think there is an additional issue for women, and that is asking for help. I think men, they might struggle as well, but I think in particularly also when it's got to do with gynecological health, which we are still, no matter how open societies have become, still hiding, still not talking about as often. You get the message you should get on with it, and especially after hysterectomies where, there are children and there are pets to be fed and there are food to be made and washing to be done and jobs to get back to, and women just persevere through it, and that's often very unwise from a physical and mental perspective. And I think that's one of the things. A doctor recently wrote to me and said, a gynecologist, that she had listened to my podcast, and one thing that had changed after the podcast was that she decided she will never do a hysterectomy again unless she's also met the partner of the women involved.
Oh, how interesting.
Because she realized just if the partner, be they male, female, whatever the partner's relationship is, if they are not prepared for what happens and are being able to be in a supportive capacity there, then she realizes how much the patient is going to suffer. And I think, how often do we just go to gynecologists or for exams?
I think that's it's really interesting. So one of my friends had a hysterectomy when she was young. She's a doctor as well. She was 38 and had a hysterectomy for another reason. And she said to me, Louise, I made the mistake of doing too much, emptying the dishwasher too quickly, and I had to be readmitted because my scar broke down internally. She said, you don't want that. So then I made this rule I loved it, for 3 months. So not quite, I didn't quite do it 3 months. But I said to the children and my husband, look, I'm really not. I've cooked for the freezer. Food's all done. I'm really not going to. And I loved the time because I worked a lot. I had my laptop on. I caught up with loads of articles and all sorts of things that I wanted to do. And that's when I created the Confidence in the Menopause course. I found a company to help me with it. I had lots of time. But it is making sure that people understand that it's a hysterectomy, and I had 3 cesarean sections. So you do naively think, oh, it's going to be similar recovery.
It's the same. Exactly. I had to. Exactly.
Yeah. And it's not the same. And
no, it's not.
And I think the other thing is, and I'm quite happy to talk about it, but the intimacy, if you do have a partner and you want to have sexual experience, it could be, I think, harder than after a baby, because especially when you've had a total hysterectomy, you can't visualize, is your vagina the same length? Does it feel the same? Your pelvic floor is not the same, and in fact, Sam Evans, who's a great, she's a nurse trained sexual health person, and she actually contacted me before my hysterectomy and said, Louise, you need to think about your clitoris. You need to think about
exactly
sort of stimulation and in a different way. And I thought, gosh, why don't we talk about this? Why do we just have to think about penetrative sex and that's all we can think about? But our clitoris isn't damaged or affected usually in a hysterectomy, and we need to talk very closely to our partner. What is comfortable, what isn't, how things change, because you say that first 3-6 months, our vagina, our pelvic floor, all those tissues change quite a lot, don't they?
And the thing about it is that, of course, in many cases, the cervix is slightly, when they remove the cervix, they also do shorten the vagina sometimes. So there is a difference in how it feels. Of course, if the hormones are, if you're affected hormonally, of course, also the vagina, as I know you speak about a lot, can get dry. And, so it's very important that get dealt with. If there's an actual wound, of course, that's sore. And then psychologically, women are worried, if there's now, because of course now if the cervix is removed, there's stitches up there, and of course women get anxious. What if that gets undone? Of course, they tell you not to have sex for the first 6 weeks, but it's quite important that partners also understand that sometimes it takes a lot longer for women to get back into the sexual game. They don't feel well, they don't feel themselves. It's going to take a lot of time and patience, and that's okay. For women also must feel that it's okay and not feel obliged. Some women on the groups are day 3 and they're like ready to rock, not wise maybe, but and I think it is that, and I think it's actually most probably something that's not only to do with hysterectomies, but is also for women in menopause generally, is to rediscover our bodies, to make peace with a body that changes dramatically, not only hormonally, but also in the aging process and so on. And for me, I write about that in the book. That's not this. In the podcast is more of a medical podcast, but the book itself, I talk a lot about how I had to go through my personal journey of looking at my body, looking at sexuality, really making, sort of really interrogating that and what it meant, and femininity and. Yeah, so I think it's not something that's unique to hysterectomies, but of course there is a sort of physical and psychological aspect to that. But I think it's also a general issue around menopause.
Yeah, absolutely. I think totally. And like I've always said, we're all individuals. So one person might have the operation, be bouncing back, like you say. Others might not, either physically or psychologically or both. And that's fine. Nothing's right, nothing's wrong. But the most important thing is that we are listened to and understood and know that, time really helps, but we can be different in our experiences of the same operation. So I'm really grateful for your time. Before we finish, you've got your book there, haven't you, just to hold up so we can show. Just 3 reasons really why people might want to read the book, whether they've had a hysterectomy or not. Many people will know someone that's having one or had one or going to have one. So 3 reasons sort of why we should look at the book or listen to your podcast series that you mentioned.
So the book, which is called Never Waste a Good Hysterectomy, the first half of the book is about my experience with hysterectomies. And women who have read it have very kindly said to me that they felt like it was them speaking. They really associated with what was happening with them, and the fear and the anxiety and the bewilderment and so on. And then there's a little bit of activism in there as well, about why not more research money is spent on specifically ovarian cancer. It's so little money and the survival rate hasn't improved. And I should say mine in the end turned out to be benign. I should have said that at some point, thankfully. So I think for me, it is about if you're feeling lonely, if you hear a voice, if you need a voice, if you need to read something that might be similar to your experience, that's definitely there. The second part of the book is more for anybody who's going through menopause. There I deal with, so many of the issues I think women go through during menopause: money issues, fears of relationships, the good girls scenario, the superwoman things, all of that. And then the third sort of thing about the podcast itself, the podcast under the same title, Never Waste a Good Hysterectomy, is a 12 episode series that is different from the book. It consists of interviews with doctors and medical experts. So it takes you through, and that's specifically for women with going or either have gone or going through a hysterectomy. It takes you from the terminology, because, I have to say I was lying on the operating theater and I had, they ask you for permission for everything they're going to do. And they said a hysterectomy and I said, yes. And then they said a oophorectomy and I sat up and I went, hold on, what's that? Here's me not knowing what they're going to do to me. So the terminology, what to pack for the hospital, what to expect on the day, the pain relief. It takes you through the recovery period afterwards, the sexual issues after a hysterectomy, the pelvic floor issues. There's an episode for men or partners specifically, and a psychological interview as well with a psychologist about the impact. And that, so if you are going through a hysterectomy or you have a mom or a friend who's going through it, the podcast I think would be very, very helpful. And women from all over the world is in the weirdest places in the world is downloading it, and clearly because they feel that they're not empowered enough by the information.
Wonderful. So lots of good tips, lots of information. Yeah, lots of reasons. But really, I'm really grateful for you opening up this conversation. You learn so much from what people really experience, but hopefully people will just think a bit more about it, and also to be able to ask the right questions if they're going for surgery themselves. So we will share the links in the notes, but thank you so much for your time. I've really enjoyed it. Thank you. Thank you very much. You can find out more about Newson Health Group by visiting www.newsonhealth.co.uk. And you can download the free Balance app on the App Store or Google Play.